knocking on patient door, patient privacy, and hygiene, cleaning stethoscope. Hi, good morning, how are you? My name is Vivian. I'll be your nurse today. Can I get your full name and date of birth? Date of birth. And do you have any allergies that I should know about? So today I'll be doing an entry tube insertion for you. It's a procedure ordered by your doctor. Is that okay with you? Okay. And do you know where you are today? And why you're here? And do you know the date? Okay, great. So I'm just going to raise the head of the bed. And then I'm going to be putting the head of the bed to high fowlers.
Once it gets past the nasopharyngeal, I'll get a light, check the back of the throat.
Okay, good. And then hand hygiene. Just gonna apply some gloves. Do you have any questions for me before we begin? Okay, great. So I'm just gonna put the pulse ox on you right here, and then I'm just gonna take a set of vital signs really quick. All vital signs are within range. Okay, and hygiene. And before we begin, I'm just gonna observe the patency of your nostrils as well as your mouth. Okay, good. And then I'm just going to do some oral hygiene so that we could prevent any bacteria from inserting. Okay, good. And then I'm just going to section as needed. Okay, good. And then I'm just going to observe your abdomen. Okay, good. And then I'm going to be placing a towel right here to prevent any spillage. Okay. And then before we begin, I'm just going to put some lubricant in here. This is going to help insert the tube a little bit easier. And then I have pieces of tape right here as well. Okay. So do you have a preference in which nostril I use? No? Okay. So I'm just going to lower this side rail. I'm just going to, we're going to be using your right nostril. I'm going to be measuring from the nose to the earlobe, and then to the xiphoid process of the sternum, and then I'm going to add around 15.2 centimeters or 5 to 6 inches, which could be right around here.
At the cheek.
And then I have a piece of tape to indicate that so I know where to stop.
Okay. Alright, looks like we're
There we go. And I have a cup of water here. I'm going to be providing you small sips of water during the insertion so that it could help, the swallowing will help the insertion of the tube a little bit easier. Take some deep breaths, Tammy. Okay, so we're going to begin. I'm just going to dip this in the lube. Okay. And then I'm going to be inserting it to the nasopharynx, and then once I reach it, the nasopharynx, I'm going to get my pen light, observe, and then I have this stick to just observe the placement. Good. Okay, and then if I do reach any resistance, I'm going to be making sure to twist the tube. So just twirl it so the insertion is a little bit easier.
And then I will end it. I think also I forgot documentation.
Okay, here we go, and then I'm going to be providing sips of water. Okay, swallowing, good, continuing my insertion. Okay, and now that I've reached the point of where the tape ends, I'm going to be securing this with a piece of tape that's cut into a Y shape. I'm just going to be taping this around, and then using the other side of the tape to tape it. Okay, good. Okay, how do you feel? Okay, I'm just going to observe your mouth. Good. And then I'm going to be putting this around your earlobe. And then I have a piece of tape to stick onto the cheekbone so that we could prevent any coiling and tangling of the cord. There we go. Okay, making sure to clamp the cord. Okay, how are you feeling? Do you need any more water? Okay, so now that we're done with the procedure, do you have any questions for me?
I know that one's hard to pick up.
Okay, so I'm gonna go document my findings. I have to document the size of the tube that I used, how the patient tolerated it, the pain with the insertion, which nostril the tube is inserted into, as well as the patient's any risk for aspiration. I'm going to make sure to just observe the abdomen, and in order to verify the placement of the NG tube, we're going to do an x-ray to verify that. And I think that's it. I think that is it. Okay, just going to take off my gloves. Okay, do you have any questions for me at all? Okay, so I'm going to put this here. And then I'm going to leave the pulse ox on you and the vital signs we're going to check. I'm going to be lowering the head of the bed a little bit. And then lowering the bed. Okay. And your collar is right over here. Please don't forget to press that if you have any questions at all. I'm going to go document my findings, and I'm going to clean my stethoscope. Thank you. Hand hygiene.